breaking barriers and bridging the gaps between patients and doctors. Welcome to Brainstorming with the Docs and your co-hosts, Dr. Glenn Harrison and Dr. Kolby Condos.
All right, everyone. Welcome back to this week's episode of Brainstorming with Dr. Kolby Condos and Dr. Glenn Harrison. I'm Dr. Kolby Condos. Dr. Glenn's the man in the pink shirt.
Pink, it's purple.
See, I'm colorblind, man. That doesn't even count.
How are you doing, Dr. Kolby?
Yeah, I'm doing well, man. It's getting good, a little busy around the house. Got a little munchkin running around. She's 2.5 now, and she's into everything.
Wow, 2.5.
I know, it's crazy how time flies. It seems like just yesterday I was in the hospital, like stressing about everything in my life, and then little did I know it was just about to get exponentially more stressful.
That was just a warm-up phase.
Yeah, absolutely. So today we picked a topic that affects a lot of people as usual, and that we're both really, really well versed in, and that is going to be inflammatory bowel diseases. Bowel diseases. Sorry, I didn't enunciate that very well. So today we're going to be talking about the different types of inflammatory bowel diseases, maybe some common symptoms, and then some possible management methods in adjunct to traditional Western treatment options. So let's get started. Why don't you break it down for us?
Okay, so what is inflammatory bowel disease or bowel diseases? It's really a blanket term trying to encapsulate many digestive disorders, and I don't think that phrase really gives credit to all these problems, all of these disorders. Inflammatory bowel disease is a big topic, and it incorporates some diseases maybe you've heard of: ulcerative colitis, Crohn's, celiac, IBS, which is irritable bowel syndrome, which is, I don't like that diagnosis either. It's not giving a reason for the problem, but it encapsulates many different disorders. And so if there's many different disorders, there's many different causes. If there's many different causes, that means there's many different solutions, which we're going to talk about today. So I guess that's kind of an intro to it, but signs can be everything from, of course, diarrhea and loose stool and constipation, meaning not having a bowel movement every day. And it could be pain with a bowel movement. It could be irritable, where it doesn't matter what you eat, there's something going on. There's always some problem. So yeah, inflammatory bowel disorders affect tens of millions of Americans in this country. And very little is really being done to address the causes, the root problems to it, and people are suffering. So I'm very passionate about this topic because it's people can manage it, people can correct a lot of the symptoms. So
yeah, absolutely. And actually, I have an inflammatory bowel disease, so I actually am I have celiac disease, so I'm positive for an antibody that affects the lining of my gut, and I'm cross-reactive to gluten proteins. So I'm one of those gluten intolerant people. So as a sufferer myself, I can say that this can be a debilitating, a totally debilitating condition. Give you a little bit of my case history, I guess, so all of you guys can have something that relates, I guess. I was doing my last internship, and I was interning in Portland, Oregon, and I got really, really sick. I'd kind of gotten an infection, and then I was really overwhelmed because we were getting ready to graduate. I'd just gotten married. We're trying to figure out where we're going to set up our own practice. We got to move all the way from Portland back to Minnesota, which is like a 24-hour drive if you go nonstop. And this was probably 2 weeks before we were starting to pack up our apartment, and I got just ridiculously sick. I couldn't, basically it was like anything I ate was just running completely through me. I lost like 25 pounds in 2 weeks. And wow. I was just completely lost as far as what happened. I'd followed a pretty strict diet. I wasn't eating like terrible, but I was just eating like a normal diet, where I was eating some, whole grains. And I was also, just following kind of a regular diet, and I tried everything. I'm like, oh man, I must have like an intestinal bug. So I ran a bunch of, stool samples. I ran a bunch of blood work. I ran everything. Couldn't figure anything out. And actually I finally went to a functional medicine doctor, and they're like, oh man, sounds like you got celiac disease. I'm like, no, it's impossible. Like, I've eaten bread, pasta, all this stuff my entire life. Well, they ran a blood test. I'm positive for celiac. And what had happened was the amount of stress that I was under at that point, in conjunction with the infection that I had, actually primed my immune system to make antibodies to my own healthy tissue. And ipso facto, I'm no longer able to eat wheat products because I have developed an autoimmunity to that basically, where my immune system, if you guys are curious about autoimmunity, we covered this a little bit more in depth in a prior podcast or whatever. So you can go back and listen to that. But so my immune system was attacking my own healthy cells, and it was really just a completely miserable experience. Anytime someone comes in with an inflammatory bowel disease, I'm completely empathetic towards them because it is just awful.
Yeah. I didn't know all the details of that story. So, maybe for some of the people listening, I know we all have our different versions of what is a normal diet. When you say normal, do you mean like real food and staying away from processed foods?
Yeah, so I was eating a lot of fruits and vegetables. I was eating a lot of protein, healthy fats. But then I was also like, if we were on the road, because we were traveling a lot at that point in our life, because we were moving, from Minnesota to Portland, and we were living in Portland. Both my wife and I are both doctors. So we were super, super busy. So, we would eat, say we went to like Chipotle. If we both got back really, really late and we got like a burrito, right? So that would be maybe a more healthy alternative, maybe not as healthy as what I was eating at home, but in a pinch, you're like, oh, it's totally fine. At least it's better than, McDonald's or something like that. Well, when you're reacting to a flour tortilla, maybe not the healthiest option available.
Mm-hmm. Yeah. So, so that's a little bit about what inflammatory bowel disease is. Now, maybe I'll get you to dive in, Dr. Kolby. What are the common types? I know I mentioned some names, but if you could describe a little bit.
As far as like the common types that I commonly see with some of my patients is be like Crohn's disease, diverticulitis, diverticulosis, celiac disease. You can go as broad or as general or as specific as you like. Those are probably the biggest ones. Some people come in and they don't know what they have, and they don't really need a diagnosis. In a lot of cases, I don't really care about the diagnosis unless I think that they're at risk for maybe a possible infection from like diverticulosis or something like that. I don't necessarily care so much about, what the specific diagnosis is, because sometimes the treatment is really similar, or not the treatment, but the management of those conditions is maybe a little bit similar. So then you look at as far as like, are they eating a pro-inflammatory diet? Are they eating any possible immune triggers? Is there any cross-reactivity or molecular mimicry between some of the foods in their immune systems so that they can produce antibodies to their own tissues and stuff like that? That's basically how I go about maybe developing like the process or the initial stages of helping this patient figure out what's going on with them.
Yeah. And what do you see for symptoms in these clinically? What do you see in your office?
Yeah. So a lot of it has to do with like issues with digestion, right? So, and it can be as one end of the spectrum to the other. So I can't eat anything without having extreme diarrhea. And then the other end of the spectrum would be I eat something and I'm constipated for 4 days. I had a patient that comes in and I'm like, how are your bowel movements? They're all right. I'm like, what's all right? Well, I'm going like once every 4 days.
Everything is always all right when you ask about bowel movements. It's normal.
That is not a normal bowel movement. You should be having at least one, probably 2 a day. Mm-hmm. One every 4 days is definitely slow transit. Then you can look at as far as like, I'm really fatigued. I just feel terrible. They have a lot of other comorbidities as far as like what, other symptoms that they're suffering from. I'm really sore. I'm fatigued. I'm gaining weight. I'm bloated when I eat. It can be really a lot of different symptoms that are a complication of maybe the inflammatory bowel disease. But that's where, good diagnostics, lab testing, blood work, stool samples, and all that stuff can come into play, because that can really kind of help you rule in or out what you think is going on. Because in some cases, even in my practice, you'll see something and you're on one track, and then all of a sudden you're like, holy cow, this person also has like extreme bacterial overgrowth in their GI tract. So we need to definitely address that too, because they have both.
That's right. Yeah. So people have these GI symptoms or gastrointestinal symptoms, and they can be so many different symptoms, but it's all just the digestive tract. And then very seldom is it just this problem or just that problem, but it can be a combined effectiveness. Like you said, Dr. Kolby, a little bit of bacterial overgrowth, some inflammatory conditions in the GI tract, and then a massive biome imbalance. And then it just turns into the snowball. And we're not even getting into higher up the GI, like acid reflux and all of that, which plays into it as well. So digestive issues, I think, are the root of all evils when it comes to health, and it's something to never ignore. So what is normal digestive functioning? Okay, maybe I'll chime in on that one if I know what normal is, but what we should see is, at least one bowel movement a day. It should be formed. It shouldn't be, you shouldn't have multiple times a week of loose stool. That's not normal. There shouldn't be pain when you have a bowel movement, and there shouldn't be relief when you have a bowel movement. Now, I mean relief when I'm saying, oh, my stomach feels so bad, but then I have a bowel movement, oh, I feel better. No, there shouldn't be that. There should be at least one bowel movement a day. It shouldn't go 2 days or 3 days, unless you had an episode of diarrhea, and then your whole colon is empty, and then it needs some time to refill. But then you have to ask the question of what's the cause of the diarrhea? And those are some of them, I guess. And of course, there should never be, stool, blood in stool. There should never be mucus. There should never be greasy stool where it's floating. You shouldn't have gas. You shouldn't be belching all the time. Those are all digestive issues that should be considered. And I think it's important to say that, because a lot of people tell me, and I asked years ago, and I used to ask, how are your bowel movements? And they would say, oh, Dr. Harrison, they're normal. And I was like, oh.
You're like, oh, okay, great.
Yeah, bowel movements are one of those things you don't talk about at the coffee shop, usually with your friends. But every day in my office, I'm talking about poop. And I know you are too, Dr. Kolby.
Oh, yeah. Yeah. I think too, like you were talking about, I don't even remember at what point it just kind of made me think of it. For instance, like Crohn's. When you look at Crohn's disease, you look at all these other things. Okay, I've got, terrible digestion. My stomach hurts. I'm upset. I'm going to the bathroom all the time. Everyone's seen the commercial. If you have Crohn's disease and you can't travel more than 3 minutes from a bathroom, not normal, right? Another complication of Crohn's is actually, and I had one of these maybe like 2 months ago, where the patient came in with severe low back pain. And I think actually we talked about this in our inflammatory or in our arthritis podcast. So if you have Crohn's and you're interested about this or whatever, obviously go back and listen to that one too. We talk about how a complication of Crohn's disease is actually you can develop sacroiliitis, which is inflammation of your sacroiliac joint, which can be extremely debilitating as well, because that's the largest weight-bearing joint in your body. So nothing to be taken lightly. I think that another key point with like this inflammatory bowel disease is your gut, your GI tract is how you absorb and digest the majority of your food and your nutrients. If you don't have a healthy epithelial lining in your gut, you don't have a really robust, microvilli and mucus layer in there, and a diverse microbiome, you're not, so microbiome is just like a bunch of bugs that lives in there. If you don't have all of these factors, you're not actually going to digest, break down, and absorb food. So then you can actually become like malnutrition. So for instance, when I had my episode, when I lived in Portland, I was malnutritioned. I had lost all of my fat stores because my body was like, holy crap, we're not getting any nutrients. Our blood sugar's going all over the place. We're going to eat all the fat he's got, and then we're going to start breaking down his muscle if we have to. So it can be really serious if it gets to that point. So it's really important that if you do have an inflammatory bowel disease, you get some help.
Yeah, exactly. And you hit a point there. When people are dealing with digestive issues, usually they're just, oh, my stomach bothers me. It's an inconvenience in the early stages. And then if it's put off, my stomach bothers me, it's inconvenient, I always have to be by a toilet, or I'm not having bowel movements and I'm always kind of in pain and I lose energy. But later on, you have all of that, but then now I'm getting really tired. And that's part of it's the nutrient depletion, like you talked about. And I'm getting irritable, which is playing directly into your brain and in your emotions. And then I get more and more tired. And then, now my joints are bothering me. Now my back is bothering me. And now I have brain fog. So that gut funnels into all these other systems. And if you ignore it, it is going to create more and more problems. We see cases like this in the office all the time. And if there's ever a digestive issue, I'm running to the gut right away to try to get that under control. So hopefully some of the other symptoms start coming offline. I'll never run to a joint if someone has a digestive problem. That's not my first place, running to a joint. Run to the gut is the title of this podcast is Inflammatory Bowel Disease and Bowel Conditions. The key is inflammatory. You don't ignore the inflammatory component of these GI issues. And if you address it as an inflammatory condition, you will cut down inflammation at every other aspect in the body. So consider it an inflammatory disorder, just like anywhere else in the body, and you'll have significant outcomes.
Absolutely. And then as far as like maybe helping with management of inflammatory bowel disease or whatever, what would you say to someone who's suffering from like an inflammatory bowel disease, as far as like options or maybe some alternatives that they can take, or maybe even some like daily stuff that they can implement into their daily lives that maybe can help improve their outcomes or just maybe help them manage some of the symptoms?
Well, it's a good question. The first place most people want to run is they want to run to find another pill, and not just a pharmaceutical pill, but a natural pill. And they are helpful, but you cannot take enough of these natural pills or even pharmaceutical pills to offset the negative effects of a poison. So you got to pull the poison away. That's the first step. And you got to know if you have a poison, meaning a food that's creating a reaction or an irritation in your body. Food, it could be a chemical, it could even be an emotional stress. So physical stress, a chemical stress, or an emotional stress hitting the body will aggravate that inflammatory condition, meaning adding fuel on your existing inflammatory bowel condition. So, with that, you're going to want a provider. You're going to want a healthcare provider to help, order the proper labs and find out what's irritating you. Once you find out what's irritating you and you have the discipline to pull the poison away from your body, then you take the next steps. Then there's, foods that drive up blood sugar. Those sugar and refined sugars, refined grains, I should say, processed foods, they all add fuel to that inflammatory bowel fire. So if you pull out those common poisons, even without a lab test, you should make some gain. But don't ignore the effects of this being an emotional triggers too. There's this lady I worked with. I think I mentioned this, Dr. Kolby, on one of our podcasts. She was having, I think it was like 5 to 7, urgent bowel movements a day. And she had it for over 30 years. And we got everything under control, found the poisons, if you want to call them that, foods and chemicals. And we did that with testing, and then used a bunch of supplements to start restoring the intestinal lining and restoring her gut biome. And she was doing great. She was down to one to 2 non-urgent bowel movements, normal bowel movements a day. Her energy was coming back. Her skin was changing because she's getting those nutrients. And then she was, then she had to help her mother-in-law move. Husband was.
I remember this story. Yeah.
Okay, so we did talk about that, and everything fell apart. And it fell apart. She called me. She was all worried. And she said, everything is the same. We backtracked. And I said, no, we never. He said, what's going on in your life? And then she told me. And I said, you have to get out of that environment. And she did. And within a week, she was back to her higher level of health again. So don't ignore these emotional pieces. I've seen this sabotage, the emotional stressors turning into a physiological problem. So don't, if you have those things, make sure you can get some help. I know Dr. Kolby can work on these metabolic cases from afar. You're out in Minnesota and I'm in Denver, Colorado. So we got the majority of the country covered.
Like right in the middle and on the west.
Yeah. So we can help from afar. I work with people all over the country and continent, and I know, and even, out of the country, I know you do as well, Dr. Kolby. So get some help. So that's kind of maybe the concepts of the natural approach. Do you have anything to add to that, or maybe you want to jump into the conventional medical model?
Yeah. So conventional with the conventional medical model, as far as like pharmaceutical interventions, that'd be like an immunosuppressant. You can get on some things that are going to help you with the inflammation.
So just to define, what is an immunosuppressant?
So an immunosuppressant is basically a pharmaceutical that's designed to drive down your immune function.
Make your security guard go to sleep.
Yeah, which is effective, but then it comes with maybe some not so positive consequences as a result, where you're more susceptible to other infections and stuff like that as well. There's other as far as like what I do in my own office, we do a lot of brain-based therapy to actually increase gut motility, which is like the process of moving food and stool and stuff like that through the system. So we do some targeted brain activities and nervous system activities to try to increase the effectiveness and the movement of the bolus and stuff like that through the GI system. Other than that, I pretty much follow a really similar management method as you do, of really just removing immune triggers and then to really make some dietary changes that are going to be really positive for outcomes in the end. So like you said, if you or someone else you know that suffers from an inflammatory bowel disease, please point them to this resource, and you can get a hold of us on our websites. My website is www.northlakescheropractic.com. You can find me on Facebook, which is North Lakes Chiropractic and Functional Neurology. Dr. Harrison's is www.drgharrison.com.
Perfect. Yeah, nailed it.
Google him.
Yeah.
Center of Functional Medicine, Denver, Colorado. He'll pop right up.
There you go. Yeah, you'll find it there. And on the website, there's a lot of information, a lot of resources about this. I even talk about lab testing. So there is hope for it, you know. There's no need to live with this stuff. You just have to look outside of the box on this one and usually look at more than just the medical model. Don't ignore the medical model ever, but look past it, because there is more. So I guess that's all I have to contribute to this podcast.
Yeah, I think we kind of made a nice round summary on this one. It's kind of a really broad topic because there's so many components and there's so many different types of conditions that would fall under this umbrella. But I think that we probably I hope we did a good job. If not, drop a comment. Let us know what you'd like us to go over, and we'll make our best effort to cover it sometime in the future. So
yeah, awesome, Dr. Kolby. Well, thank you very much. I look forward to the next one.
All right, man. Sounds good.
Bye-bye.